I work for the West Virginia Bureau for Public Health. I'm an environmental inspector. My wife as well does the same exact thing. We work together, we live together, we go to church together. We're also licensed ministers through the Church of God, and we minister at the Princeton Church of God in Princeton, West Virginia. In September of 2016, I really started to notice some arrhythmias, heart palpitations. There were some irregular heartbeats.
His heart kept racing. We would even get on treadmills at hotels because we worked together. You could tell that his heart would instantly start racing, and then automatically his heart would stop a beat at times.
I ended up going to my primary care physician, Dr. Remines. Dr. Remines ordered a 24 or 48-hour heart monitor. And on Tuesday, my doctor called me with the results and wanted to see me. And when I went to his office, he explained that I had V-tach. So I asked him if he could give me a medication or do something right here in his office, and that's when he explained that it was more than he could do right there in his office. So he needed to refer me to somebody in Roanoke, a cardiologist. So my primary care physician, Dr. Remines, referred me to Dr. May, and they first did an echocardiogram to determine the structure of my heart to make sure there weren't any deformities of my heart. So all of that looked okay. However, I was having this arrhythmia V-tach. Still didn't understand a lot about it, but he actually gave me 3 ways to treat it, that they could treat it. One of them was an implantable defibrillator. At this point, that wasn't a good option because I was going into V-tach so much that the defibrillator would just continue to constantly shock my heart. The second way was medications, anti-arrhythmia medications, which he didn't like that idea because of the side effects that could happen with those types of medications in my age. So the third option was a catheter ablation, a cardiac ablation, which that was probably the option that was the most likely to treat my situation. So during my initial visit with Dr. May, he let me know that he had a case Friday morning, so he wouldn't be able to do the procedure or the ablation. So he referred me to one of his colleagues, Dr. Hamid. And at that point, I was a little worried because here in my hometown, I had heard of Dr. May's work and how good he was. So I just asked Dr. May, I said, Dr. May, I said, so this gentleman that you're referring me to, Dr. Hamid, so is he as good as everybody says you are? And his answer to me was, if I had to have something done to my heart, he would be the gentleman to work on my heart.
Previously, of course, I've had several family members that have had to go to Roanoke Memorial for heart conditions and things like that. So when our family doctor decided to send him there and told us that he was headed to Roanoke Memorial, I was kind of excited because at least I knew, I was familiar with the facility, I was familiar with the people there. It's always been a pleasant experience. My father had a heart attack and he was there for several days. My brother had open heart surgery there. So I was actually glad when Dr. Remines, our family doctor, referred him to Roanoke Memorial Hospital. During his procedure, right before, Dr. Hamid came up to the room and he spoke to me and his mother and assured us that everything would be fine, that he didn't anticipate any problems, that he would be down there for a while, and all the nurses, the doctors, the staff, everyone was just so appeasing to all of our needs. They were just wonderful.
I don't understand a lot of what takes place, but he had to map out my heart to look for this circuit and basically pinpoint this lesion that he was going to ablate. And I could have went home that evening. They were willing to discharge me. However, I was still a little concerned about my heart, just wanted to make sure that it was going to function properly and wanted somebody in the medical field to monitor it. So I opted, if they were okay, for me to stay the additional night, which would have been Friday night. And so I did. They monitored my heart all night, and there were no more arrhythmias. So I was very thankful.
Since the surgery, Jarod started exercising a lot. He's got up to running 6 miles. He's also lost over 40 pounds. So no more irregular heartbeats, and everything's been good. I'm
back to doing all the things I did before I was having these arrhythmias, so I really feel great. I really think that, everybody's demeanor, their tact at Roanoke Memorial, I mean, it's calming. It has a calming effect. Even when the nurses were a little bit excited, they were still calming. They were comforting. They reassured me that things were going to be okay. And you know, I would like to just offer my thanks to everybody at Roanoke Memorial, all the medical staff, the clerical staff, the administrative staff, Dr. Alma Hamid, I mean, great physician. I can't say enough about him. Without the grace of God and the fine medical professionals at Roanoke Memorial, I'm not sure I would be here doing this interview with you today.